feeling constantly tired, low sex drive, struggling to build muscle, and you might be wondering, could it be low testosterone? And if so, is testosterone replacement therapy the answer? Well, before you rush off to try and get a prescription, there are some really important things you need to know. Because testosterone replacement therapy, often called TRT, isn't a magic fix. And in many cases, it might not even be the right treatment. So stick around to find out why. So what is testosterone and why does it matter? So testosterone is the key male hormone responsible for muscle growth, bone density, red blood cell production, and yes, libido and energy levels. Naturally, testosterone levels decline with age, but does that mean every man with fatigue or low sex drive needs testosterone replacement? Well, not necessarily. Okay, so common symptoms and other possible causes. Symptoms often linked to low testosterone, like fatigue, brain fog, low mood, weight gain, erectile dysfunction, and low libido, are actually really common and can be caused by a range of other factors. Things I see all the time as a GP. Poor sleep can cause these things. Stress, depression, having an underactive thyroid, which we call hypothyroidism, having nutritional deficiencies like low vitamin D or iron, even just being overweight. Frequently we see things like medications like antidepressants or opioids causing these symptoms, excessive alcohol use, and type 2 diabetes. So that is a long list, isn't it, of causes of those symptoms. So jumping straight to testosterone therapy without checking for these causes might mean missing the real problem and therefore the right solution. So by jumping straight to testosterone, you may not feel any better and you might have missed the problem in the first place. So how is low testosterone diagnosed? We doctors don't diagnose low testosterone based on symptoms alone. A proper diagnosis requires a blood test, ideally taken in the morning when testosterone levels are highest. If your levels are low, your doctor will check again to confirm before considering any treatment. Many men who suspect they have low testosterone actually have levels within the normal range, and I see this a lot, and I think it comes back to the fact that the problems are actually not low testosterone. So who actually needs testosterone replacement? So TRT is mainly for men with clinically diagnosed hypogonadism. So this is a condition where the body genuinely struggles to produce testosterone. And this can be due to factors like genetic conditions, damage to the testicles, such as from injury, chemotherapy, or infection, pituitary gland problems affecting hormone production. If your own body does not make enough testosterone and reversible causes are excluded, then you may benefit from having supplemental testosterone, which should be initiated by an endocrinologist. This is a specialist hormone doctor. And for these men, TRT can be life-changing, improving mood, energy, muscle mass, and libido. But for most other men experiencing general fatigue or stress-related symptoms, testosterone therapy is unlikely to be the answer. So what about the male menopause? Well, the male menopause, sometimes called the andropause, is it real? Well, it's actually an unhelpful term because it suggests the symptoms are the result of a sudden drop in testosterone in middle age, similar to what occurs in the female menopause. But this actually isn't true. So although testosterone levels fall as men age, the decline is steady. It's about 1% a year from the age of 30 to 40, and this is unlikely to cause any problems in itself. Okay, so what about any risks or side effects of TRT? Is it worth just trying to see if it makes you feel any better? Well, testosterone replacement isn't risk-free. So some potential side effects include increased risk of blood clots and potentially stroke, acne and oily skin, male pattern baldness, irritability and aggressiveness, weight gain and swelling, breast tissue growth called gynecomastia, fertility problems, as this therapy can suppress sperm production. It can worsen your sleep apnea, and there is a possible link to prostate issues. So that list of side effects isn't insignificant, is it? So when you think about maybe it's just worth trying to see if I feel better, then do consider all those side effects. And don't just, especially if you're like, my mate down the gym says he can get me some testosterone, I would just say, think twice. And this is why it's crucial to have a proper medical assessment before considering TRT. So don't buy it online or from your mate down the gym. Okay, so what can you do instead? So if your testosterone levels are normal, but you're still feeling low on energy, then actually you should be really thinking about those lifestyle changes that naturally support testosterone production. So there are things you can do to boost your own testosterone. All right, what can you do? Sleep well. So you want to be aiming for 7 to 9 hours a night. So stop kind of binge watching Netflix series until the early hours of the morning. I see you. Manage your stress. So chronic stress raises cortisol, which actually can lower your testosterone. So think about things you can do to manage your stress. Exercise regularly. So especially things like strength training and HIIT, so high intensity interval training, these can naturally boost your levels of testosterone as well. And healthy eating, so eat a balanced diet, prioritizing protein, healthy fats, and enough calories. And then this kind of links with the importance of maintaining a healthy weight, because actually extra body fat can increase estrogen levels and reducing your testosterone levels. So that's not the way you want it. And cut down on alcohol. I know I'm kind of giving you a list that sounds really boring, isn't it? But this can also impact your hormone balance. Okay, so it's all the stuff you already know. Healthy eating, exercising, cutting down on alcohol, it's getting plenty of sleep, but it really can make a difference to your testosterone and therefore your symptoms. So, testosterone replacement therapy can be a game changer for the men who truly need it. But for many, it is not the quick fix they expect. So before seeking treatment, make sure you've ruled out other causes and optimized your lifestyle. Thank you for watching. Please do share with anyone else who might find it interesting. Please do like and subscribe, and I will see you next time.